I'm Enoch Akowuah. I'm a cardiac surgeon. I work at South Tees in Middlesbrough, and I lead the Arrhythmia Alliance Hearts of Ghana mission group. So we're going to Ghana for the fifth time. This will be our fifth trip to Ghana to perform heart surgery as a group. And over the last 5 years or so, what we've done is worked with colleagues in Ghana to provide heart surgery and cardiology services to people who can't afford to have those services in Ghana. Over the years, our mission really has, in a way, transitioned from our very first mission, where there was absolutely nothing. I remember arriving in Kumasi to a room that was empty, and we're told this will be your ICU, and having to essentially build an ICU from scratch, bring in the beds, bring in the ventilators, absolutely everything. To now having a group of colleagues in Ghana who are able to actually perform heart surgery on their own in our absence. And we've transitioned really to kind of supporting that whole process. And the key focus of this fifth mission is to introduce the team to more complex cardiac surgery, and in particular aortic surgery. So the real focus of this mission is to perform aortic root replacement surgery. This is surgery that's never been done in Ghana by this team, by the Ghanaian team before. So we'll be doing the cases with them, teaching them how to do the cases, and then hopefully subsequently going forward they'll be doing those cases on their own. So that's the real sort of core of what we're doing this time. Alongside that, we've got a huge educational program. So we've got a big meeting on the Saturday and the Sunday, the first 2 days of the mission. There will be over 200 clinicians and allied health professionals attending the conference center, the University of Ghana Medical Institute. Professor Buvana, who's one of my colleagues, along with Christina and Tim Strange, who are also clinical colleagues, have put together an amazing program which has been designed with the Ghanaian team, and they'll be delivering lectures, workshops, seminars and hands-on teaching to, as I say, nurses and other professionals from across the greater Accra region. So we're really excited about that as well, as the clinical work we'll be doing. The need is obvious. I mean, there are loads of slides and loads of data. There are lots of ways of sort of, I guess, painting a mental picture. But Ghana has a population of 35 million people, and there is only one fully functional cardiac surgery unit, which does about 200 adult cases a year. And if you compare that to the UK, who have 75 million people, and we do over 30,000 cardiac cases a year, that just tells you the huge gap there is. So why is it important? It's important because people need these services. There's a huge prevalence of cardiac disease in that part of the world, and there's no ability to deliver that. And where there is ability, it's hugely expensive, and even the wealthiest Ghanaians can't afford it. So really it's about just building up capacity, building up skills, and providing opportunity for people to have what is essentially life-saving procedures. It's a huge team. There are 17 of us. There are 2 surgeons. We've got 3 anesthetic colleagues. We've got a number of intensive care nursing colleagues. We've got allied health professional colleagues. It's a huge team, which essentially includes everything you need to deliver this sort of procedure out in Ghana. A lot of these guys have been to Ghana before. There are a few people who are going for the first time, but colleagues like Joel Dunning and Christina Ruiz-Segrea and others have, like me, going on the 4th or 5th mission. So we're hugely excited. Part of the reason why we do it is because it's great fun to spend time with each other, and also great fun to kind of meet up with our Ghanaian colleagues who we've built fabulous relationships over the years. So that's excellent. The other aspect of the whole mission is the cardiology aspects as well. So we're not just doing cardiac surgery, but we're doing pacing for patients who've got complete heart block, and we're doing interventional cardiology, so angiograms and stents for patients with coronary artery disease, and my colleague Justin Carter, who works at North Tees Hospital, will be leading that part of the mission. So it's a mixed group, but really fantastic, dedicated group of colleagues. there are patients in Ghana who have critical cardiac and cardiology diseases that can't be treated, and every penny that people give to allow us to go and do these missions goes to providing care for those patients. For a lot of patients, we are able to operate on them without them spending any money at all. So we have some people who really are quite destitute, and so all that money goes to the front line and to the patient. So that's the key thing really. Without the funding, we can't do these missions. We have to fly and accommodation and buy the equipment that we need to do the operations, etc. So I think the funding is critical. We're really grateful to partners in industry, etc., who help us. But I think the individual donations in the just giving is absolutely critical, because that's what really allows us to get this work done. It's for us, it's fantastic to be partnering with Arrhythmia Alliance, Hearts of Ghana. The charity is critical in terms of making sure that the infrastructure is in place. It allows us to concentrate on doing the clinical work, whilst the charity kind of makes sure that everything around us works effectively and efficiently, and that's critical. And our ability to kind of work with other people within the charity who are doing other things, particularly with pacing and electrophysiology. It just means that we can kind of deliver a much bigger range of services as well. So yeah, those are some of the values of working with Arrhythmia Alliance.